My name is Theodora Soder, and this is the Salt Lake Tribune's Daily Buzz, a daily video series where we bring you the important story of the day. So, the Utah Department of Health and Human Services does not track the procedures that Utah hospitals offer statewide. According to a spokesperson, DHHS has no plans to track these procedures in the future either. This is a problem because the lack of transparency means consumers can be left without the knowledge they need to make an informed decision about where to go in Utah for a procedure, unless, of course, a facility voluntarily discloses that information. Because a new law will close all 6 of Utah's abortion clinics and shift that care to hospitals, this information asks the question, which hospitals will add abortions to their long list of procedures, and will they share that information with the public? Centura Health is acquiring 5 new hospitals with its joint operating sponsor Common Spirit Health along the Wasatch Front. The nonprofit is a Catholic-affiliated healthcare system that does not provide elective abortions, vasectomies, tubal ligation, in vitro fertilization, and other reproductive health services in order to align with their new owners' quote, ethical and religious directives. The new acquisition could result in 5 fewer treatment facilities for Utah seeking reproduction health services starting in 2024. While Centura and Common Spirit Health didn't respond to the Tribune about which procedures they may choose to restrict, the most recent copy of the Ethical and Religious Directives for Catholic Healthcare Services states Catholic healthcare institutions are not to provide abortion services. The directives define abortion as the directly intended termination of pregnancy before viability or the directly intended destruction of a viable fetus. In a written statement, the healthcare system told the Tribune, Centura Health and Common Spirit Health are excited to bring our healing ministry to Utah. As a not-for-profit, faith-based healthcare system, we will bring patients new clinical care options, collaborate with the community to have a greater impact on the future of healthcare, and provide care that is guided by our Catholic values. The statement also noted that patients and providers will see no changes to the services provided ahead of the acquisition's close, but it is unclear whether the hospitals currently provide such services. And the Tribune asked Steward Healthcare, which currently operates the 5 hospitals, if they offer such services. Josie Martin, the hospital system's Vice President of Strategic Communications, said, "At the moment, we have no comment in response to your questions." The Tribune reached out to other hospital systems in Utah in an attempt to learn what procedures they do and do not offer. Intermountain Health, the University of Utah Health, and Mountain Star Healthcare declined individual interviews and responded in a statement from the Utah Hospital Association, which represents the policy interests of hospitals throughout the state. Jill Vickery, the association's vice president of member and community affairs, said in general, hospitals in Utah do not offer elective abortions, but those select healthcare systems do provide surgical contraception and in vitro fertilization. She added that they also offer some gender-affirming surgeries for adults. Asked for how Utah hospitals will adapt to the new law that shifts abortion services to hospitals and whether providers have concerns, Vickery said each healthcare system in Utah will need to quote, determine how to respond to the bill's passage. So we want to know what you think. Do you think hospitals need to be more transparent with the public about the procedures they provide? What do you think of the shift of services from abortion clinics to hospitals? Do you know of any hospitals within the state that offer reproductive procedures? Let us know your thoughts by either leaving a comment below or tweeting us at SLTrib. Or you can respond to the Google form attached to the story at sltrib.com. And if you want to watch the Daily Buzz as soon as it drops each morning, be sure to subscribe to our YouTube channel. Thanks so much for watching. We really appreciate it.